Why do some patients need catheters? Nursing edition. Urethral catheterization is a routine medical procedure that facilitates direct drainage of the urinary bladder. It may be used for diagnostic purposes to help determine the etiology of various genitourinary conditions or therapeutically to relieve urinary retention, instill medication, or provide irrigation. Catheterization is normally a clean procedure but can also be sterile in other cases. Many patients must rely on a catheter for avoiding the bladder either temporarily or permanently due to incontinence. Catheters may be inserted as an in and out procedure for immediate drainage, left in with a self-retaining device for short-term drainage e.g. during surgery, or left indwelling for long-term drainage for patients with chronic urinary retention. The process of urinary catheterization can be divided into 4 steps: explanation and consent, preparation, procedure, and aftercare. The procedure itself is different in men and women due to the differing pelvic anatomy. Preparation. Choose the correct catheter size based upon sex of the patient, length of time of insertion, and any allergies to latex. Once at the patient's bedside, reconfirm the patient's identification. Expose the patient from the waist down throughout the procedure. Ensure the patient's dignity is maintained. Prepare your sterile field next to the patient's bedside. Open the outer packaging of the catheter pack onto the trolley and decontaminate your hands. Carefully open the catheter pack, touching only the outside border, and arrange the contents of the catheter pack. Without touching the catheter directly, insert the catheter along the urethra into the bladder. If any resistance is felt, ask the patient to cough to ease insertion. Once the urine begins to flow, advance the catheter a further 5 centimeters. Inject the contents of the syringe into the catheter to inflate the balloon in the catheter. Monitor the patient for any signs of discomfort.